Welcome and thank you for joining us today. You are listening to a calm, clear and trusted news voice, bringing you verified local developments from Pattaya, Chonburi and surrounding communities. Please take a moment, settle in and allow us to guide you through today's important events that continue to shape tourism, public health, community safety, and daily life across Thailand's eastern seaboard. We begin today's coverage at Pattaya City Hall, where city leaders and national tourism officials are moving forward with preparations for one of Thailand's most important international tourism trade events. On Monday afternoon, Pattaya City Mayor Poramis Nampichet presided over a key planning meeting focused on the upcoming Thailand Travel Mart Plus, scheduled for 2026. The meeting took place shortly after 2 o'clock inside Pattaya City Hall and brought together senior representatives from the Tourism Authority of Thailand, along with provincial officials and private sector tourism partners from across Chonburi province. Officials discussed strategic responsibilities, coordination between agencies, and logistical planning as Chonburi prepares to host the second edition of this major tourism showcase. The event, set for June next year, is expected to draw tourism operators, buyers, and industry leaders from across Asia, the Pacific, and global markets. Traditionally organized at a national level, this year's Thailand Travel Mart Plus will be jointly hosted by Pattaya City, the Chonburi Provincial Administrative Organization, and regional tourism networks. The goal, officials say, is to ensure seamless cooperation, smooth operations, and strong international engagement. The Mart serves as a critical business platform, connecting Thai tourism providers with overseas partners, while highlighting the country's diverse travel products, cultural experiences, and service standards. Local leaders stressed that careful preparation is essential to present Chonburi and Pattaya as capable hosts and to reinforce confidence in Thailand's tourism recovery and long-term growth. From tourism planning, we turn now to a matter of growing public health concern affecting communities across Chonburi province. Earlier the same day, Pattaya's deputy mayor chaired an important meeting of the Pattaya Health and AIDS Network, bringing together healthcare providers, government agencies, and civil society organizations. The meeting focused on rising concerns surrounding sexually transmitted infections and HIV, particularly among younger age groups. Health officials reviewed data from the 2025 fiscal year and presented updated operational plans aimed at prevention, treatment, and education for the coming year. According to the data presented, Chonburi Province continues to report infection rates higher than many other regions, with adolescents and young adults showing increased vulnerability. Particular concern was raised over the rise of 3 major sexually transmitted infections, including drug-resistant gonorrhea, syphilis, and genital warts, often associated with HPV. Health authorities noted that the majority of new cases are occurring among individuals between 20 and 29 years old. Officials emphasized that many of these infections are preventable through correct and consistent condom use, regular testing, and early treatment. The network agreed on the need for accelerated action, including stronger surveillance, expanded outreach, and closer monitoring, especially for drug-resistant infections. Special attention will be given to high-risk areas and vulnerable populations, with coordinated efforts between hospitals, public health offices, and community organizations. The meeting also reinforced Thailand's commitment to ending AIDS by 2026, in line with the international 95-95-95 targets. These goals aim to ensure that most people living with HIV know their status, receive treatment, and achieve viral suppression. Additional priorities include condom education among teenagers, integrated care for patients with co-infections, and expanded public awareness campaigns. An awareness initiative is already being planned to coincide with Sexually Transmitted Infections Day in February next year. Health officials say continued vigilance, education, and community cooperation will be essential, as national data shows STI rates have steadily increased since 2018. From public health, we now turn to a sudden emergency incident that unfolded at a roadside food stall in Chonburi. 3 street food vendors were injured after a gas-related fire broke out during cooking in the Sriracha district. The incident occurred shortly after 1 o'clock in the afternoon at a made-to-order food stall located near a convenience store along a busy roadside area. Emergency services were alerted quickly, and fire crews along with rescue teams were dispatched to the scene. Firefighters managed to bring the blaze under control within approximately 15 minutes, preventing it from spreading to neighboring shops. Initial assessments indicate that the fire was caused by a gas leak during the replacement of a gas cylinder, while food was actively being prepared. Rescue personnel removed the gas cylinder, shut off the valve, and secured the area to prevent further danger. All 3 injured individuals suffered flash burn injuries, including redness to the face and body caused by sudden exposure to flames. First aid was administered on site before the victims were transported to hospital for observation and further treatment. Witnesses in the area described a sudden flare-up that spread rapidly, prompting nearby vendors to move additional gas cylinders away, fearing a secondary explosion. Authorities say the rapid response helped limit damage, and no structural collapse was reported. Local officials are now expected to review safety procedures related to gas handling at street food stalls, particularly in high-traffic areas. We now turn to a tragic development following a long and emotional search in Chonburi province. A 55-year-old woman who suffered from Alzheimer's disease and had been missing for 2 weeks was found deceased in a wooded area. Her body was discovered late in the morning behind a petrol station near Highway 331 in the Bang Lamung district. The discovery came after members of the public alerted local police, who then coordinated with rescue teams to secure and examine the site. Family members, who had been actively searching, arrived at the scene and confirmed the identity of the deceased. The woman had been reported missing earlier in December after leaving her home while experiencing memory impairment. Her disappearance prompted widespread concern and public appeals, including social media outreach, as days passed without any confirmed sightings. CCTV footage reviewed during the search showed her walking near a local junction, but no further footage captured her movements beyond that point. Based on those findings, family members and volunteers concentrated their efforts in the surrounding wooded area, leading to the eventual discovery. Police stated that no immediate conclusions were released regarding the cause of death, pending further examination. Rescue workers transported the remains to a local hospital, where formal procedures will be completed. Authorities confirmed that the family will be able to proceed with religious funeral rites in accordance with tradition. The case highlights the dangers faced by vulnerable individuals who go missing and the emotional toll prolonged searches can have on families and communities. As we conclude today's report, these stories reflect the diverse challenges and ongoing efforts shaping life in Pattaya and Chonburi, from tourism development and public health to emergency response and community safety. Thank you for taking the time to stay informed. Thank you for watching and listening. We appreciate your trust, and we look forward to bringing you the next verified update. Stay safe and take care.